What if you get to the magical 10 centimeters and you do not feel the urge to push at all? I don't know how social media got so excited about the urge to push, but today I'm going to discuss what to do if you don't have the urge to push, what the urge to pushes look like, and how to know when it's time to push and how to do it best. I'm so glad that you are here. These are things that I've seen in my 20 years in labor and delivery, plus talking to millions of you online, plus 3 babies of my own. I'm here to tell you it's a lot less complicated than people seem to put on social media, which is true for pretty much everything. So let's push ahead into pushing.
Announcement. The pregnancy nurse is a nurse, but not your nurse. This is informational, not medical advice. Thank you.
Okay, I'm first here to tell you that everyone sort of describes this differently. Some people are calling it the Ferguson reflex when you have this urge to push, and I would describe that very similar to when you know you need to have a bowel movement. Like, it's there, we gotta go, we gotta get in the restroom. Same idea with when you have a baby. You feel a lot of pressure and you know that you need to push it out. But some people talk about this fetal ejection reflex, which honestly, in thinking about it, I'm not sure that I've ever seen it. They act like it's like you vomit and baby just comes out. Like there's nothing you can do to stop that. I'm not sure that I've seen that on very many patients. Editor Hillary to say that I just wanted to be really clear that people talk about this fetal ejection reflex like it's you just like push a button and the baby comes out. Sometimes the baby does come out very quickly and you can't really resist your urge to push. But I don't know that I've ever seen it where it's just like on that video, you push a button and the baby comes out. I don't know that I've ever seen that in 20 years in labor and delivery, but there can be a very strong urge to push that you cannot stop. It's just baby is coming out, just not like push a button. Although wouldn't that be amazing if like your belly button was an ejection button? And I should remind you guys that at the hospital I started at, the vast majority did not get an epidural. So when I started in labor and delivery, it was with a lot of unmedicated natural patients who I just don't feel like I saw this where they were just like immediate push out. So take that for what it's worth. But I do see a lot of very strong urge to push, or Ferguson reflex as some people call it. And we're going to talk more about that too. But you got to realize that everyone sort of describes this differently. So just because your friend down the street was like, I felt a strong urge to push, it may not feel to you like you're envisioning it felt to her, if that makes sense. And I also want to be clear that the urge to push a lot of times is blunted with an epidural, but it doesn't have to be. I actually have a whole video on customizing your epidural that I'm going to link to down below, because you can also allow your epidural to help you feel a little bit more than you would feel normally. So it's just a not a well-known tip, but so important. Be sure and watch that video. But I should say, even on natural patients, sometimes when you get to 10 centimeters, you really don't feel an urge to push. And so what do? Stay tuned. We're gonna talk about that. But first, let's talk about that urge to push. Like I said before, you can be 10 centimeters and not have that urge to push. So that doesn't mean that anything's wrong or labor's not going to progress or you're going to have a C-section. It's not unusual. A lot of times the urge to push happens when baby descends a little bit further into the birth canal. And I also want to tell you the good news, especially if you're going without an epidural, is that it feels really good to push against the pain. A lot of times people, are in transition and there's all this pain and they're thinking, how much worse can it get? But in reality, once you're starting to push, it just feels better because you're able to push against the pain instead of just trying to relax and breathe into it, which can be really difficult. I also want to say that the urge to push can actually happen before your cervix disappears. So in reality, when you're 10 centimeters, it just means that the cervix, the bottom of your uterus, has pushed past the baby's head. So we can't feel it anymore around the baby's head, but it is back here. But you can have the urge to push while there is still cervix around the baby's head. And if you were to push while the cervix is there, it can swell and be really problematic, which is why we usually want to do an exam to make sure that cervix has all disappeared before we start pushing. It's not super common for that to happen, but it happens enough that it's really important that we do an exam. And by the way, if you have issues with an exam, I have a whole video on ways to manage the pain of an exam. I'll link it down below. Okay, so you don't feel that giant urge to push. What do you do now? Well, there are studies about it. So there is a big study that showed we should not delay pushing, that you should just start pushing right away. And then there was a recent study that showed that you could have up to 3 hours of delaying the pushing and still not have really poor outcomes. So As you can tell, the data is mixed, which of course means that it is up to you. It's really up to your situation. But I do want you to know some caveats about this. If you wait to push, we call that delayed pushing, you do have an increased risk for hemorrhaging, which means once that placenta comes off of the uterus, this area is a big scab and you can bleed a little bit more. Now, this happens more often if you've had a really long labor and especially if you've had a long induction. So that's something important to think about when you're making this choice for you. Very different if you've had a long induction versus if you've come in labor, haven't been there very long, your chance of hemorrhage is pretty low. Another issue is an increased chance of infection, which again could be more prolonged if your water has broken for a long time or if you've had a long induction or things like that. Repetitive vaginal exams just to check how far along you are, it can increase your chance of infection. So if you've had all of those things, it may be a reason why pushing immediately might be better for you than waiting. It has also been shown to possibly cause more pelvic floor injuries. There's ways that the baby just like sitting in your pelvic floor can cause injuries to between your vagina and your rectum, which of course we do not need those areas open to each other. So that can be an issue, but I think that's more of an issue if baby has been low for a long period of time versus if baby's still up high. So, when you're 10 centimeters, if baby's still up high, maybe you want to wait a little bit versus if baby's low, even if you don't have the urge to push, giving it a few tries might get that urge to push to go for you. And let me remind you, as I remind you in every video, every situation is different. And this is a great discussion to have with your nurse and your provider about when you should start pushing. And they should include in that information, do you feel the urge to push? Do you want to push? That should be part of this question. In the studies, waiting sometimes decreased your total pushing time, which can be a big win. Remember, on your first baby, average pushing time is about 2 hours. Most of this discussion is about a first baby because on your second, third, fourth, fifth baby, it's much less. Fifth baby, we might sneeze it out or laugh. I've had a lot of patients where I'm like, we have to stop laughing. Your doctor's not here. So very much a first baby discussion right now. But some of the studies also show that it really didn't decrease your pushing time if you delayed pushing. And I'm also here to tell you that if you are 10 centimeters and we're waiting to push, during that time frame, every 20 to 30 minutes, you should be changing position, going from the side, sitting up, even if you have an epidural. If you don't have an epidural, moving around the room, squatting, all those different kinds of things. You should be using movement and gravity to your advantage because if we're delaying pushing, we're ultimately deciding that we want to let that uterus squeeze down on baby instead of you engaging in the pushing yet to hopefully save your energy so you can get, not have to push as long and give better energy towards pushing. Because as you can imagine, if you get, to hour 3 of pushing at the end, your effort just starts to wane. Like if Hillary were to run a marathon, I would die probably, but I would be crawling those last few miles. And finally, I want to remind you that it is always up to you. If your provider is like, no, we're not going to push yet, there should be a reason for that. Obviously, if the cervix is in the way, they would encourage you not to push. But if they're like, well, we don't use delayed pushing in our hospital, but you're not feeling an urge to push and you would like to wait, it is always up to you. So talk with your provider, get informed consent about the risks, the benefits, and the alternatives of pushing or not pushing. And the other good news is you can always change your mind. You decide, I'd like to wait to push a little bit. And then 5 minutes later, you start to get the urge to push, start pushing. Or you're like, okay, let's try pushing. And, you get 10 minutes into it and you're like, I'm still not feeling anything. I would like to maybe turn down my epidural and see if I can feel a little bit more. Can we give me a 20-minute break? As long as baby looks fine and everything, that should be fine too. You can always change your mind. That's a good thing about this, especially with pushing. There's a lot of people who are like, no, once you start pushing, you're going to push until you have that baby. No, if things aren't working, you're not feeling it enough, turn down the epidural, try different things, try different positions. I have a ton of videos here about different ways to push, so I'll definitely recommend that you guys watch that. But the cliff notes of those videos is that everyone is different. Pushing works different for every single person, and you got to find what works for you. And luckily, you are the expert in you, so I love that about you. Now, this is one of the lies of pushing, but there are more lies of pushing that I'm going to link to up above. I hope this helped you understand it a little bit more. Again, we get tiny snippets about this on social media and you got to learn the whole big picture. So I'm glad that you guys are here. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth.